Washington's governor is expected to ban gatherings of more than 250 people in most of the Seattle metro area. The state thinks it could get tens of thousands more cases of coronavirus. Public health officials say at least 10 long-term care facilities in the Seattle area have reported cases. Patients have died at 3 of those facilities. Jonathan Vigliotti is outside the Life Care Center in Kirkland, Washington, the epicenter of that outbreak. Jonathan, how severe is the problem?
Yeah, and Anthony, to put in perspective just how vulnerable the elderly are, of the 32 confirmed deaths around the country, 20 of them are linked to this nursing home. All of this as now state officials here concerned as well as residents remain on edge.
This is how Bridget Parkhill and her sister now visit their mother, who recently tested positive for coronavirus at the Life Care Center in Kirkland.
How did you process that?
It wasn't a shock that she was positive. It should have been a priority to get everybody tested so they could get all the negative people out of here before they turned positive.
But a shortage of tests meant only the critically ill were prioritized. At least 11 other long-term care facilities in Washington, including the Josephine caring community, now have infected residents or staff.
The facility is in lockdown, so no visitors, no consultants, and no families. And I can tell you that's incredibly tough.
In Northern California, officials confirmed Tuesday that an assisted living resident in their 90s died there. A recent study examining coronavirus cases in China found that in people over 80 years old, the death rate was nearly 15%. In Seattle's King County, 74 more cases were announced Tuesday, bringing the statewide total to more than 260.
If you do the math, it gets very disturbing.
Governor Jay Inslee outlined new rules for nursing homes, including limiting patients to 1 visitor per day and screening employees and volunteers for symptoms at the start of their shift.
The number of people who are infected in an epidemic like this will double in the state of Washington unless we take some real action here.
And if you have a loved one in a nursing home or a facility like this, experts have some recommendations. They say call the facility, check on their staffing and their cleaning procedures. They're also recommending keeping your distance. Call or use FaceTime if possible. And if you have a loved one inside, keep them there. Experts say it could be risky to remove them at this point. Tony?
Jonathan, thank you very much.